because we've been in the operating room all the time. Today it's a lot of patients, and we have one of my beautiful patients here today that, you know, I find at the middle age, you start to notice some of those things that start to come down, like the middle face, you start to get little jowls, you like having your brows and your cheeks more lifted and everything kind of pulled back. So we're gonna do like a Snatch Me liquid facelift right now, where we do a little elevation, softening around the mouth, bringing the chin forward, and just gonna make her look all tight and refreshed. And again, one of the areas where now she has really good cheek volume, but there's just a support issue right here, meaning like it's just starting to come down. So we're gonna use a filler that has the ability to kind of lift and give her a little contour. I think she's gonna love it because it's gonna snatch her cheeks. And this is gonna be our starting point of our treatment plan. The first step is volumize and lift, and then our second step is gonna be improve the quality of their skin and give her more tightening. And so you guys see here, like just that little bit, I feel like always makes a difference for girls. You can see it pretty much instantly, which I love. And we're not even doing that much, although it may seem like it's a lot because it's a lot of areas. The amount that we're actually doing is very little. Even Jordan behind the camera over here is like 4 to 8 syringes in his jawline, right? What do you got?
Something like that.
A lot. There's a lot over there. So we were able to do a little bit of lifting. You guys see here in the cheek. Let me see this side. Great. Yeah, all over there. So you guys see now there's support right here where we want. In this area where there's typically a little crease that kind of forms as the ligament descends as we get older. And you know, with weight loss too, a lot of our patients on GLP medications, or people are getting ready, they're running marathons. Whatever you're doing to stay fit and healthy in this active lifestyle times, we are definitely getting some facial volume loss earlier in life because of it. So again, I want to give her some contour pretty high because I want to get a lot of lift. And again, that support right here on that crease right on the bone. Now, for those that have a lot of pain sort of, or a discoloration, let's say under the eyes, switch around me, that's fine. Discoloration under the eyes, a lot of doctors want to just put filler there. My suggestion wouldn't be always to do just filler under the eyes, because sometimes it needs laser, sometimes it needs lifting. You see already it's improved, but we're gonna do a little bit of layering today. First step, I'm gonna do on her chin to give her that heart-shaped look. We're gonna do a 3-point technique. And you gotta be careful about bringing the chin too far down. We wanna just bring it forward because this is going to give her a lot more support. So you guys see here, even that small amount. Jordan, go to that side, yeah. Show them just that little projection, what it did, now it's matching. And then we're just gonna come a little bit on the outside toward the jowl slightly, just to get a little lateral support. I don't wanna make her too wide. This is just kind of that support. One more. Good. And now you guys see it's more blended. Now one of the tricks that we're gonna do is take our cannula, and this limits pain and bruising, which is great. And we're gonna soften, turn it head this way. The lines, it's okay. It's all right. Turn a little more. We're gonna
Everyone's probably
soften.
seeing how good she looks on live and they're calling her.
Really? That's good. Yeah, exactly. That's cute. We're gonna soften with a much thinner filler here to blend the lines, the space between the chin and the lips. And this is called the marionette area. And this allows us to improve the downward turn of the lip. You guys can see here. And soften the nasolabial fold, but also the crease of the chin. I know it feels weird there. Perfect, so that's one side. Stay there, hold on. Leave. We're also gonna go a little bit, just a little. We don't traditionally do as much to the folds, but by going into the piriform, you can lift the lip and you can improve the under eye because the cheek comes up a little bit. So we're gonna go kind of deep. You can feel it there, deeper on the bone, and then down the fold to soften it slightly. And that now then softens this whole area. And we're gonna do the same thing on the opposite side. So we're gonna switch. Perfect. She's doing great. Oh, it looks really good. Okay, lift up again and lift to the right. So now we're gonna do that same thing again. We wanna soften this right here, right where there's volume depletion through this triangle and this triangle. And we can do that all with a longer cannula. So you guys will see it's kind of a weird feeling. Doesn't feel the best, but at least it's way less painful. And again, we're kind of going through that tissue. And this will blend her pre-jowl, so her jawline is gonna look more snatched and she's not gonna jowls. What a benefit from just a few syringes, it's great. We can also do toxin, which we'll do around the mouth at the DAO and the pre-jowl and the jawline. Again, doing the chin crease slightly. There we go. A little bit more right at the edge. You guys see right here. A little right there. Good. Okay, now you go again, and we're going to soften just that area right above the fold. She says filler here lasts her so long, which I think is great, so that we can get just a little bit in there and it'll stay for a long time. I'm going to go right to that pure form over here. Good. Okay. So far, so good. Looks amazing. Now, let's do a little bit more on the cheek area because I want to get more lift. I probably will do a technique where we come all the way back onto the fascia. And this will lift. One, she's going to love it because it's going to give her a lot of contour on her bone. But this will pull up and help her fold a lot more. Perfect, right there. So we're gonna hold over here. Perfect. And then we're gonna switch. Hold on. So I'm gonna do that same thing over here. A little more support in her mid-face here. So female facial sculpting really needs a little bit of artistry, you guys. And understanding of the anatomy.
It's not just drawing a line and filling a certain amount of filler in one area.
No, and that's the thing that I find, especially with newer injectors or people that are learning, the companies will teach you to draw the lines, but it's all customized to the person. All right, so the last part, and this is gonna be one of my favorites, we're gonna do Renuva.
I would say this is pretty special. This is very unique to us.
We're gonna do a little Renuva. So, right now you guys see here in my hand, I have this little yellow mix. So we're gonna go a little bit higher. We're gonna layer, we were on bone. Now we're gonna go a little higher. And where we normally would do, let's say, some filler, just making sure it's all flat, good. We're gonna use a biostimulator. So this is called Renuva. And this is a synthetic cadaver fat, basically, matrix that stimulates your own fat to grow. And I find it looks really natural in this area when it's done right. You're just gonna do a little bit. It's gonna look a little more puffier today because it has to be mixed. But once it settles in, this whole area looks way less hollow. You could even do up in the corner of the eye or in the temple. I might have a little extra to do the temple, which will blend her cheek. I'm looking right now. We'll know in a second. All right, you're almost, turn a little bit more. There you go. But I like this because this will end up giving her much more of her own natural volume in this area. And then when we laser, it's gonna look incredible because it will tighten everything. Okay, you guys see I'm blending this and going even to the lateral crease of her eye, because this whole area are superficial fat pads that can be blended, and it will look really, really nice once the swelling's gone down. There you go. Okay. So remember, it's not a filler, but it's going to stimulate the area.
So talk to him a little bit about biostimulator versus filler.
Exactly. So more people nowadays are not wanting to do fillers because they're nervous that everyone gets puffy. All right. So what we do now is we do things like Sculptra, Renuva to stimulate your own fat and collagen. And so now this looks way smoother. This looks softer, and she doesn't have jowls. And then what I'm gonna do is a little cherry on top. I'm gonna do one pinch in the temple.
And what about some fillers that do have biostimulator properties?
Like Radius, for example, and Bellafill. Those fillers will build collagen so that you look better, more better than you did when you first started. Sorry, honey. There you go. But you will lose some of that volume over time. With this, you gain it, and it keeps you more refreshed.
Can you tell, I was gonna say, tell them something special that we do is we can mix both of them together here.
Yes, and that's what I usually do. So pan-facially, we could even do that for her temple area, or when we do a laser to stimulate more lifting. All right, so we're gonna do now an Emer reveal, because she's done. We're gonna show her what that mid-face looks like, what the chin and the jowls.
She looks great.
And we're gonna see if she likes it. She's gonna tell us. All right, so grab
And
your
if she
phone.
doesn't, she'll tell you too.
That's right. So you're gonna
All
hold
right,
it
so
45
grab
degrees
this.
like this, so you can look your chin up a little bit so you can see it. So hold there, and now take a look. What do you think?
Wow, I love it.
So what did you see? What do you see?
I feel like even my lip kind of lifted.
So that was because I did that right there. That's what I like.
This is straight,
Yes.
I don't have that.
That was the goal.
My chin looks more,
Yeah, especially since it's more in line.
this looks perfect.
That was the key, because you guys, as you get a little bit older, this goes down and resorbs back. So you want to bring this forward and you want to soften through here. So we used filler across here. Here, the filler here lifts the lip, and then again that layering. We did the bone to give you contour, and then the under eye with the regenerative injectable.
I love it.
So now you have more of a contour, which I like because it gives you that kind of Model-esque look, and the neck looks better.
Mm-hmm.
What do you think? All right, now let's show you now. This is great. Let me show you now in the mirror. And then that's it. And then you're done. And we'll prepare for round 2 in the future. Here, hold. I'll bring you up just a little bit. But again, do 45. Yeah, no, not on the phone. Lay back. Hold here so you can see 45. What do you think?
I love it.
I know. It looks really, really
I
natural.
love my cheeks.
I know. Me too. I knew it would be a little. It's also good because she had a little heaviness here, you guys. So by doing, look, when I go like this, it pulls up. That's why you can do things like threads, but even doing the filler here and here, just hold that whole area up. And it looks great.
It looks natural.
That's the key. That's the key, because you guys know everyone can look puffier nowadays with fillers placed incorrectly, especially the under eyes. That's why I like doing the removal there. So take a look. You just sit and relax. Look straight ahead so they could see, because they're gonna be jealous right now. And then you could show her that facial sculpting. It looks great. Amazing. Beautiful.
Love
All right,
it.
now I'm gonna do tox.